Breast cancer surgery is a huge milestone, but what happens next? The doctor visits slow down. Suddenly, you're left wondering, what now? I've been there. I'm Dr. Liz O'Riordan, breast surgeon and breast cancer survivor, and I know firsthand how overwhelming recovery can feel. But these 7 essential steps will help you heal faster, reduce discomfort, and start feeling like yourself again. And here's what you'll learn. The #1 mistake that leads to more stiffness and pain, how to protect your scar so it looks great when it's healed, and why too much rest could actually slow down your recovery. But first, let's tackle one of the biggest concerns after surgery, pain. Now, pain after surgery is different for everyone. Some women feel a deep aching under the arm, others feel burning or tightness in the breast. Think of pain like a smoke alarm. It's there for a reason, but if it's too loud, you can't focus on healing. So what should you do? Take your painkillers regularly. Don't wait until the pain is unbearable. Use protective pillows in the car to go between the seatbelt and you. Wear a bag for your drains so they don't pull on the skin. But pain isn't the only thing that can slow your recovery. Not moving enough after surgery can cause serious issues. And many women avoid moving their arm because they're scared of hurting themselves. But this is the thing, not moving actually makes stiffness worse. Think of your shoulder like a garden hose. If you don't use it, it kinks and tightens. And the same thing happens to your muscles after surgery. So what should you do? Start gentle shoulder movements as soon as your doctor allows, and I'll put a link in the description for a routine you can use. Try to move your shoulder a little bit more every day and make this a habit for life, because shoulder stiffness can come back, and I've had it. And if you found my video useful so far, remember to like and subscribe to my channel. But taking care of your scars is more than just movement. You also need the right skincare routine. After surgery, scars can feel tight, dry, and itchy. Taking care of them early prevents long-term discomfort. Think of your scar like a new pair of leather boots. If you don't soften and care for them, they'll become stiff and uncomfortable. So once the dressings have been removed and the wound has healed, moisturize daily with a fragrance-free lotion like Aveeno, and massage the scar gently, and this will stop the skin sticking to the tissues underneath. Your team might recommend silicone gels or tapes to stop the scar thickening. Now, speaking of movement, let's talk about something that might surprise you. Your bra matters more than you think. Your breasts may be sore and swollen after surgery, and they need a bit of TLC to stop them moving when you toss and turn. You may even need to wear a bra at night for the first month to help everything heal inside. But what kind of bra should you buy? Your post-operative bras should be soft and non-wired. Natural fabrics like bamboo are great as they let your skin breathe. Front-fastening bras are much easier to put on when your armpit is sore. And post-mastectomy bras will have a little pocket that you can put a soft prosthesis in. You won't be given a proper fake boob until you're 6 to 8 weeks post-op. And if you've had a reconstruction, there are bras that are longer in the body so they don't rub over your drains, and they have adjustable hooks as your breasts become less swollen. Check out the description for details. Now, these bras are more expensive, but they are worth it. And you might want to get 2, one for the day and one for the night. And while you may think you need to rest after surgery, too much rest can actually make recovery harder. Think of your body like a rechargeable battery. If you don't use it, it won't hold the charge properly. So what should you do? You need to stay active. Spending all day on the sofa isn't good for anyone, even on your first day home. Try to walk for 30 minutes every day, even if it's just around the house. It stops you getting a clot in your legs, which can have serious consequences. Then you'll feel like you've earned your afternoon nap. Once you've been given the all clear at the post-op check, you can build up to your normal exercise routine, and I'll tell you what that should look like in the description. But what about those days where you just feel totally drained? Let's talk about dealing with fatigue. Think of it like your phone battery. Some days you wake up at 100%, and other days you're already at 20%. What do you do? And you'll hate me for saying this, but try to do your 30-minute daily walk. Lots of studies have proven that exercise is the #1 cure for fatigue, but then you get to listen to your body. Have that afternoon nap if you need it. Plan your days to balance rest and activity. Recognize that you won't have as much energy. Eat healthy meals full of fruit and veg and drink plenty of water to keep your energy levels up. And finally, let's talk about something that no one tells you, but it's so important. How do you accept that your body has changed? Because healing isn't just physical, it's emotional too. And after my mastectomy, it took me 5 months to look at myself in the mirror. I wouldn't let my husband see me naked. I didn't feel like me. Intimacy was hard, the skin was numb, everything felt different. But time is a great healer. I want you to remember that there is no rush to look at your scars, especially if you've had a mastectomy. Do it in your own time. And you could try touching your breast and your scar with your eyes closed. You can do it in the shower or when you're putting body lotion in. It's still you, it just feels different. And this may sound corny, but telling yourself you are beautiful when you're looking in the mirror can help. It pushes away all the negative thoughts you might be feeling. You could even pose for a photo shoot, and this worked wonders for me. If you're still struggling, talk to your breast care nurse or go into your local cancer centre. They may have a support group or a therapist you can see. Remember, you are so much more than your breasts. Breast cancer recovery is a journey, but you will get through it. But what about what comes next? Watch this video to find out more about the hormone blockers letrozole and anastrozole and their side effects.